Wonderful. Thank you for the introduction and welcome everyone. Hopefully this talk teaches you a little bit about HPV that you may not have otherwise known. I think we have an hour allotted, although I don't expect it will take the whole time. And if there are any questions, obviously, feel free to ask them at the end. So I will get started. My disclosures, I do not get paid by anyone who has anything to do with HPV, the treatment of HPV or diagnosis or anything like that. I am on the Speakers Bureau for a company called Signatera, which works with cancer surveillance for patients with colon cancer. I guess the other disclosure is that I will be saying a lot of words that people don't like to hear, like warts and anus and rectum and vagina. So if you weren't expecting that, you may want to log off now, but hopefully that does not come as a surprise. So HPV, in short, stands for the human papillomavirus. We're hearing a lot about viruses these days, but basically the human papillomavirus is a virus, so not a bacteria. They function a little differently. It's pretty similar, and I bring up this comparison later, but to almost like the chickenpox virus, because you can get it at one point in your life and then it can come back to haunt you later on. This is a picture of HPV in its form. So at first, I kind of wanted to touch on just the basics of HPV. Most people know that if we're talking about HPV, that's what causes genital warts, which is really gross to think about, I know. But unfortunately, warts are kind of the least problematic part of what HPV does. It definitely is the cause of genital warts, but it does a lot of other stuff too. So the important thing to know about HPV and about viruses in general, usually we talk about a virus like, oh, there's this one human papillomavirus, but that's typically not how it works. Kind of like the flu, everybody knows there's a couple different strains out there, or, with COVID, we're hearing about it all the time. HPV is the same. There are about 100 different serotypes that have been identified. They are all human papillomavirus, but they function a little differently. And some of those serotypes are going to be lower risk, tend not to cause cells to kind of transform into a malignancy or a cancer, whereas others of those serotypes are going to be more high risk and more prone to develop cancers or do other bad things. And so we'll talk kind of about the difference between the two. Now, I think the most important thing, if I want people to walk away with anything from this lecture, it's the fact that almost every single person on the face of the earth is exposed to HPV at some point in their life. The CDC estimates that I believe 95% of sexually active individuals will be infected with HPV at some point. That doesn't mean they show signs of infection, but it means that they're exposed to the virus and that it kind of was in them at some point in time. So this is, we all like to think, oh, sexually transmitted infections, that's not going to get me, or that's for other people. Really, HPV, if you've kissed someone, is pretty unavoidable. So it's kind of almost everywhere in the population, basically. Now, the one good thing about the virus is that it can be controlled by a normal immune system. A lot of times what will happen is the virus will be exposed, it will kind of come into our cells, and our body does a very good job of just kind of killing them off or keeping them at bay so that it doesn't turn into an actual infection or outbreak of warts or anything like that. Excuse me. But that being said, normally an immune system is not going to kill the virus off. Typically, if you're infected, the virus is going to stay there. It just might be quiet. Sorry, I'm getting over a cold. All right, so as mentioned, HPV is everywhere. Almost everyone will be infected with at least one serotype of HPV at some point in their life if they're sexually active. Most people will never know they've been infected. Most people will never have an outbreak of warts. Most people will have no signs or symptoms. As I mentioned, the virus just kind of lays there, dormant, not causing trouble until it causes trouble. This can occur with any intimate sexual contact. Intercourse is not necessary for infection. And that's another really important point. People think of sexually transmitted infections. Oh, it's going to be transmitted in sperm, semen. This is really any body fluid. Saliva carries HPV, so it doesn't necessarily require actual sexual intercourse to be passed from one person to another. Now, why do we care so much about HPV? Obviously, no one wants to get genital warts, so that's one reason to care about HPV. But in my mind, the more important reason to care about HPV is because it can cause cancer in a lot of different places, actually. So most people know cervical cancer is caused by HPV. That's pretty much taught in the schools. We learn it in sex ed. Everybody knows that that's where cervical cancer comes from for the most part. But cervical cancer is really only one of many cancers that can be caused by the human papillomavirus. Anal cancer, the vast majority are caused by HPV infection. And actually, and this is typically the most shocking one, oral cancers. So cancers of the tongue, tonsils, head and neck can be caused by HPV infection, which a lot of people don't know. The other three mentioned on here, vulvar, vaginal, penile, these are basically going to be like skin cancers that just grow in areas that are very close to areas that are involved in sexual activity. So the vulva, which are the lips that cover the vaginal opening, the vagina, the penis, anybody can get skin cancers in these regions that are caused by HPV. Now, as mentioned, almost 100% of cervical cancers are caused by HPV. If we're going to get into talking about specifics in terms of the serotypes, 16 and 18 are found in more than 70% of cervical cancer. So those two serotypes are known as being incredibly high risk to as causing cancers. Now, anal cancer was mentioned. HPV is detected in 90% of anal cancers. So as I said, a very, very common cause, and 70% of head, neck, oral cancers. That's well more than 50%. So even though most people think of, tonsillar cancer, head and neck cancer, throat cancer as being something, oh, that's a smoker, someone who smoked cigars their whole life, they're actually starting to realize that a large proportion of these are caused by HPV infection. So I figured since we're going to be talking about these cancers, we might as well talk about where they actually are, because in medicine, we tend to use these words and assume everybody knows what they are. And a lot of times we don't. So the cervix basically is a little donut, for lack of a better word, that sits at the top of the vagina. So if you look at this picture here, we have the vagina leading up to the uterus, and the cervix is basically what divides the two. So not something that you can see from the outside. This is why going to your GYN, getting GYN exams is so important. That's the issue with a lot of the cancers that are caused by HPV. They end up happening in places that we wouldn't really see them until it's too late. So cervical cancer, no one else other than your gynecologist who's looking with a speculum exam is really going to be able to tell you that there's a cancer growing there. Now, what is anal cancer? Everybody knows the anus. It's kind of the star in between the butt cheeks. That's how I think of it as a colorectal surgeon. And so what is the anus? It's actually the entrance to the anal canal, which is about a 4 centimeter tunnel, basically, that's lined with a kind of a mucosal membrane, just like the vagina or the inside of your mouth. And that leads to the rectum, which is the kind of beginning of the large intestine. This is a colorectal surgeon trying to do an exam on a friend. That's not actually what it's like if you come to see me in my office, but I thought it was a pretty demonstrative photo. So if you get anal cancer, this is what ends up happening to you. It's a bummer. What is oral cancer? So like I mentioned before, oral cancer, you have really anything in your mouth with a mucosal lining. So your inner cheek, the floor of your mouth, your tongue, your hard palate, your tonsils. Usually they tend to be in the back, but you can get oral cancers that are more in the front. But like we mentioned, if you have a cancer growing on your tonsils, a cancer growing at the base of the tongue, which is actually way back here, you're really not going to be able to see that. Most people aren't going to have symptoms until that cancer is pretty sizable to cause an issue. So that's the dangerous thing with these cancers, is they're growing in places where you really can't see them. So who is at risk of getting HPV? I mean, some of this is going to be pretty common sense. If it's transmitted through sexual interactions, people who have had more sexual encounters are going to be higher risk than people who have had less sexual encounters. So if you have an early age at your first sexual encounter, multiple sexual partners, or high risk sexual partners, you know, hooking up with people that you don't really know, never talking to them again, that kind of thing. Or having sexual partners who engage in other high risk behaviors like IV drug use or those kinds of things. If you personally have a history of sexually transmitted infections, the thought process behind that is just, if you've been exposed to one, since 95% of people have been exposed to HPV at some point in their life, the likelihood of that person also having HPV is pretty high. So patients who have a history of genital warts, vaginal or vulvar dysplasia, they specifically are going to be at risk of not just having HPV, but having HPV that might progress to cancer. So if you've had warts grow, typically when cancer grows, it starts as warts and then just gets bigger and bigger and bigger. Or dysplasia is basically a really fancy word for cells that have started to kind of turn into cancerous cells. So if you have a history of that, it does put you at a higher risk of eventually developing a cancer caused by HPV. And then immune suppression. As I mentioned at the beginning of the lecture, people who have a normal immune system, you really can kind of keep the HPV at bay. Just kind of keep it quiet so it's not active, not causing any trouble. But patients who are on immune suppressing medications, patients who've had transplants before, patients who have autoimmune disorders, or patients who are immune suppressed because of HIV positivity, they all will have a higher incidence of HPV turning into cancer because their immune system just isn't going to be as strong or as effective at keeping the HPV quiet. And then cigarette smoking also has a big correlation to HPV turning into cancer. We don't exactly understand, although we do know that cigarette smoking is carcinogenic, but it does seem to correlate in cervical cancer, and I believe as well as anal cancer. So kind of just an interesting fact. So who gets these cancers? So there have actually been a lot of famous people who have had a number of cancers caused by HPV. Farrah Fawcett, she's a little old, but for those of you who remember, Farrah Fawcett had anal cancer. Val Kilmer, I want to say, had head and neck cancer. This is Erin Rogers. She's like a sportscaster. She had cervical cancer from HPV. Marsha Cross had anal cancer from HPV, and her husband actually also had oral cancer from HPV, and they believe it probably was the same strain that caused her anal cancer and his oral cancer. And then Michael Douglas also had oral cancer. He's been pretty vocal about that, and his was also caused by HPV. So we may not think it's something that happens a lot, and I mean, not a lot, but there are a number of pretty well-known people who have dealt with this disease. So, unfortunately, women do tend to get HPV infections more often than men, and so have HPV associated anal cancers. 4,700 new cases of HPV associated anal cancers are diagnosed in women each year, and only about half of that are diagnosed in men each year. So these are not huge numbers, but interesting that as women, you're higher risk of having that HPV infection turn into cancer than men. So what is the cure? That's what everyone wants to know, right? HPV is out there. This sounds terrible. I don't want to get cancer. I don't want to have warts. So how do I get rid of it? Unfortunately, there's really no treatment for HPV. So if we were going to be really strict and say, all right, how can you prevent yourself or keep yourself from getting HPV? You can say hi to your friends. That would be fine. You could hug your friends. That would probably also be okay. You cannot have sex with people ever. And that is not really a way to live life. So probably not something you guys will pursue, but I figured I'd put it out there. If you never wanted to have any sexual contact for your entire life, you might be able to prevent yourself from ever getting an HPV infection. So, as I mentioned, there's really no cure. There's really no way to fully prevent HPV infection. Who has heard of chickenpox and shingles? And I mentioned this at the beginning of the talk. So everyone knows when you're a little kid, you get chickenpox. We now have the vaccine, which is all fancy. When I was a little kid, we used to have chickenpox parties where one kid would get it and the mom would invite all the other kids over so they'd all just get it and get it over with. Chickenpox when you're a kid is just these little itchy red bumps, super annoying. My mom made me take a bath in oatmeal. It was gross, but you get your chickenpox, it goes away, and people usually don't really think about it again for the rest of your life until we become adults, and that same virus that caused the chickenpox can just kind of lay dormant in your system. So you don't have active chickenpox anymore. You had your outbreak, it went away, but you're not cured. The virus is still just kind of hanging around. And if you have a stressful event, go through something that affects your immune system, people can kind of pop up with shingles, which is a blistering red rash that happens kind of along a distribution of nerves. We call it a dermatome. And that's because the chickenpox virus was kind of hanging out at that nerve root and then caused shingles to happen. HPV works in the exact same way. You may get HPV and have no signs or symptoms of it. You may get an infection and have a couple genital warts pop up. You go to your doctor, they burn the warts off, they go away, never come back. Oh, great, I'm cured. I never have to think about it again. But that HPV is still laying dormant in your system and can still come back and bite you later on in life. I have had patients who present to me with anal cancer and they're, 85-year-old women. They've been married for 60, 70 years and they have no idea how this happened. It's probably a virus they contracted when they were very, very young, and it just kind of was hanging out and then decided to cause trouble much later in their life. So how do you protect yourself? We have HPV vaccines. I'm not trying to go on like a whole pro-vaccine thing, but honestly, if we're going to talk about viruses, vaccines are really some of the only ways of protecting yourself from viral infection. And so the HPV vaccine when it first came out, it, I believe, protected you from 4 of the serotypes of HPV. So I mentioned that there's over 100. 4 out of 100 is not great, but they were able to kind of identify the most common ones that cause issues, and they protected against those 4. They've now expanded that. They found other high-risk HPV subtypes, and they now have a 9-valent HPV vaccine that protects against all of the HPV subtypes mentioned here, 6, 11, 16, 18, etc. Basically knowing that these are the HPV subtypes that are the most common and the most high risk for turning into dysplasia or cancerous lesions later in life. So I know a lot of people say, oh, my kids aren't sexually active, they're young, they don't need to get the HPV vaccine. A vaccine is most effective if you get it before your first infection. So I would say that having a young kid would mean it's the ideal time to give them the HPV vaccine, because it's hopefully before they've made out with someone, before they've started experimenting sexually, even just kissing people. And so by giving them the vaccine, you're more likely to prevent them against exposure that will happen later in their life. The HPV vaccine is now, when it first came out, it was really only approved for kind of teens and young women. Now it is approved for men and women up to age 45, because they're realizing how much correlation there is between HPV infection and cancers, especially the head and neck cancers, which was a really shocking discovery. And really just in the last 10 years, that's become pretty widely known, and a lot of the guidelines have changed in terms of treatment and things. So, we're really still learning about this stuff every day and every year. In clinical trials, the 9-valent HPV vaccine prevented cervical dysplasia. So we talked about dysplasia is what eventually turns into cancer, genital warts, which no one wants, and when cancer does start growing, it usually starts as warts and then kind of gets bigger and turns into cancer, and anal dysplasia. So again, this would be the precursor to anal cancer. I thought this was a good graph, and it's a little busy, but I'll try to kind of just make it really clear. They did a big study in Australia looking at vaccination. And so if you look at this dotted line, this is the female graph is on the left, the male graph is on the right. So that dotted line is basically when they began to have a pretty widespread campaign to really focus and emphasize on vaccination in younger people with the HPV vaccine. And so as you can see, this is the number of patients who were diagnosed as having genital warts at their first visit by age group. So in the beginning, if you had patients who were 21 to 30 years old, about 12% of those patients, when they go to the doctor, are going to be diagnosed with genital warts. Less than 21, it's about 8%. Greater than 30 years, it's about 4%. But all of those lines, the second they start this campaign and start vaccinating more commonly and more frequently, most of those numbers really went down significantly, particularly in the younger age groups. And the older age group, you would presume that most of those patients over 30, you're probably already exposed, so the vaccine likely would be of less benefit to you. But in the younger age groups where you might be vaccinating people before they're really experimenting a lot sexually and having a large number of sexual partners, then you're able to prevent them from getting HPV infection and developing genital warts or worse. And you can see that same trend in males in the other graph. So this is just looking at HPV associated cancers per year in the United States. And I thought this was interesting because this looks at the actual serotypes. So I mentioned the HPV vaccine covers against 9 serotypes, right? 16 and 18 were two of them. And then this 31, 33, 45, 52, 58 were also in that group. So if you look at testing they've done, and now it's pretty routine. When I have a patient who presents with any anal dysplasia, it's always going to be tested for the HPV serotype. Cervical cancer, HPV 16 and 18 causes the vast majority. That same trend you can see in oropharyngeal cancer or oral cancer. Oral cancer is way more common in men, but the vast majority of oral cancers in men are caused by HPV 16 and 18. And then when you get to the 31, 33, those ones, it is less common, but still a pretty good proportion. And this is why the HPV vaccine was kind of spread out or broadened to include these serotypes. You know, if you think you have the HPV vaccine and you're protecting yourself against the dark blue and the light blue, that means the odds of having these cancers develop are going to be much, much lower. So really the best way to protect yourself. And so this is kind of the close of my talk. And on a personal note, this is a picture of my husband and my two boys, which I know they're adorable. Thank you very much. But my husband, when I was in my second year of fellowship, was diagnosed with HPV-mediated oral cancer of his tonsil, and it had spread to the lymph nodes in his neck. So obviously it was really scary and really crazy. Before this, and I mean, I had gone through medical school, I had gone through a whole surgical residency. Two of my closest friends from medical school were ear, nose, and throat surgeons, and they dealt with this all the time. I had no idea that HPV caused oral cancer, not a clue. Just wasn't on my radar at all. And then obviously, after going through it with him and talking to my friends and learning about it, I was just kind of shocked at, I looked at this as a public health crisis almost. This is a 41-year-old male who's very healthy, doesn't smoke except when he's golfing with his friends like 2 times a year, you know, doesn't drink a lot, no other risk factors really, and developed cancer when he was in his early 40s. Which is pretty unusual and pretty scary. And luckily he's fine now. He had surgery to remove the tumor in the lymph nodes, and he's, you know, we've been getting screening and everything, and they've all been clear. So fingers crossed. But it really kind of on a personal note just makes me feel really passionate about spreading the word and helping as many people understand, you know, what HPV means. It's not just genital warts, which nobody wants, but nobody also wants to talk about. But HPV, even more importantly, means cancer for a lot of people. And if that's something we can help prevent, then I'm doing my job. So hopefully that talk was at least somewhat educational. Hopefully it made you smile at least like 3 times. That would be great. If anyone has any questions, please feel free to put them in the chat. And I think that is it for my talk.
So while you guys get your questions ready, I just want to remind you guys the evaluation link is in the chat as well. So when you get a chance, please click on it and fill out the evaluation, the survey for this presentation tonight. And you can also unmute yourself to ask a question too if you don't want to write the question in the chat as well. So the first question is, if you had HPV, can that cancer later on in life?
So yes, 100%. Most people will be exposed to HPV pretty early on when they start kind of experimenting sexually. So obviously we talked about doesn't need to be intercourse, but most people by their, you know, mid-20s will have had a number of sexual encounters at that time and presumably will be exposed to HPV. Now, sometimes that first initial HPV infection does manifest itself in warts. Sometimes you're just getting your routine pap smear and your doctor says, oh, it came back abnormal or atypical, and we tested it and it looks like there's HPV in here. So you may not have even known that you had it until you go, for your routine lady visit every year. But yes, so that virus, that HPV can kind of lay dormant in your system for, years and years and years and years. Marsha Cross was diagnosed with anal cancer when I believe she was in her 50s. She likely was exposed to that HPV virus that caused that anal cancer when she was in her teens, 20s. So, the virus, your body never really cures you of it. And it can, cause cancer 10 years later, 50 years later, 70 years later, any time really.
If you are in your early 40s, should you get the HPV vaccine since the guidelines have changed to age 45?
That is a really good question. We don't have data to answer this question, so I will be honest about that, because we haven't studied it basically, and so we just don't know 100%. So honestly, with most data and most studies, everything can be argued for or against. I try to just think of things in a simple way. What makes sense to me, what doesn't make sense to me. So having the HPV vaccine protects you from multiple serotypes. Yes, you may have been exposed to HPV earlier in your life. We don't know what serotypes you were exposed to. Maybe it was 1, maybe it was 15, maybe it's high risk ones, maybe it's low risk ones. In my opinion, the downside to the HPV vaccine is minimal. It's incredibly safe. The side effects are exceedingly rare. And if you can do, get a simple series of shots to protect yourself from possibly contracting a new HPV virus that maybe you didn't have before or hadn't been exposed to before, then that only increases your chances of preventing yourself from having, issues with that later in life. So for example, my husband, who has had an HPV mediated cancer and is not yet 45, has started he's in the middle of his series to get the HPV vaccine, because we both felt like there's minimal downside, and if it can help protect him in the future, then that's only a good thing. So I would say yes, I would get it.
So as we wait to see if there's any more questions, I just would like to say thank you for this talk this evening. And thank you as well to everyone that joined us this evening as well. Thank you for joining us. And if there's no other questions, please remember to fill out the evaluation link that's in the chat box. I'm gonna send it out again right now. And I will greatly appreciate that. Thank you again, Dr. Yes.
I just wanted to say one other thing. My husband is sending me text messages because apparently he logged in to watch this. So he said that both his primary care doctor and his ear, nose, and throat cancer doctor told him that he should get the vaccine. So they both supported it as well. So, and especially with the ear, nose, and throat doctors, they're seeing a lot of these HPV mediated head and neck cancers. And so I thought that was valuable information to pass along. It's not just me, my husband and his 2 doctors both said that they thought it could only benefit him to get the vaccine. So there's another vote in support. And I think, did another question pop up?
Yes, it says if you have a HPV mediated cancer, should you get the vaccine? But I think
there's your answer. It was like handed to me. So Yes, I would say yes. Any other questions? Just so you guys know, because people do ask me this a lot, if, how do I know I get anal cancer if now I'm terrified because my pap smear told me I had HPV and you're telling me that no one's going to be able to see it. So honestly, usually they grow internally, so you're not going to know. But if you start having bleeding on the toilet paper when you go to the bathroom, most of the time that's hemorrhoids, but the only way to know for sure is to get it checked out. So blood or feeling any type of growth down there. Typically cancers are going to be kind of lumpy, bumpy, abnormal feeling, but anything unusual, it can't hurt to go to your doctor and just have them take a look and make sure nothing bad is going on. Because if you catch it early, it's always better than catching it late. So